My name is Juraj Riečan. I am the director of the Statistics Division at ESCWA, and I have the pleasure and honor to moderate the session on measuring social justice. Over the past 2 days, we heard many times the question, how to measure social justice, and we will try to find an answer through our 3 esteemed panelists. Allow me first to highlight the 3 main areas of that statistic faces in relation to social justice. The first area, being of great concern to people in our countries, are indicators related to affordability and access to basic goods and services. There is a number of indicators that we already collect on this area. And however, there is further need for developing indicators related to crime, violence, and population dynamics. Data on equal opportunities are of great interest to politicians as well as citizens. Such data are often available from academia, from civil society. And it is important to bring this data into a context of official statistics, to link it with data that we do collect through official statistics, and to ensure their impartiality and reliability. The third area is statistics on people's well-being, requiring that we go well beyond traditional social economic indicators, well beyond GDP per capita, well beyond monetary poverty measures, and so on. This is a challenge because even such information can be obtained only through subjective measures, through perception, measuring perception of people, and we have to turn this perception into reliable statistics. Having said what the challenges are, allow me to introduce our 3 esteemed panelists. Mrs. Martine Durand, Chief Statistician and Director of the Statistics Directorate of the Organization for Economic Cooperation and Development, represents an organization that has done in-depth research into statistical issues of social justice, well-being, social progress, and OECD has also developed a solid methodological framework that is a starting point for other initiatives, including ESCWA's efforts to address measuring social justice in the Arab region. Mrs. Ola Awad, Minister of Palestinian National Authority and President of the Palestinian National Bureau of Statistics, represents a developed national statistical system in the Arab region that combines experience and expertise in providing reliable statistics to national policymakers, as well as experience in overcoming the hardship of conflict and occupation. At the same time, the conflict and occupation add additional dimension to traditional socio-economic processes that enter into monitoring and measuring social justice. Mrs. Ola Awad represents also the world of official statistics, being the president-elect of the International Association for Official Statistics. Mr. Shantanayan Devarajan, Chief Economist of the World Bank's Africa region and Principal Economist and Research Manager for Public Economics in the Development Research Group, Chief Economist of the Human Development Network and a Director of World Economic Report 2004, represents an organization addressing the core development issues for social economic progress. The World Economic Report 2004 that he led was entitled Making Services Work for Poor People. Therefore, we can learn from the World Bank's experience on how to translate measures of official statistics into policies, for example, in the areas of education and health. After this presentation, let me to give the floor to the first of our panelists, Mrs. Martin Duran. You have the floor, and we will listen to the framework for measuring social justice developed by the OECD.
Thank you very much, and good afternoon, everybody. I represent here the OECD, which is the organization regrouping the 34th most developed countries, more advanced economies in the world. At least that's how it represents itself. And I'm going to present to you, first of all, I'm very honored to have been invited to this meeting and to address this very important issue of social justice and measuring it in particular. This is my area of expertise. What I would like to do today is to take you through a very important initiative that the OECD has developed, starting a long time ago, but culminating in 2011, when the OECD celebrated its 50th anniversary and tried to change its vision and approach to policies in particular, and decided to go for a new motto, which is better policies for better lives. So we are really at the crux of all the discussion that have taken place today, which is to improve the living conditions of the people in the different OECD countries, but also beyond, and doing so by promoting this notion of social justice. So in 2011, we launched what we call the OECD Better Life Initiative, and that's what I'm going to present to you today. So why is it that, first of all, we're interested in measuring living conditions better? The point is, of course, as you will all know, that 2011 was a time when the recession and the big crisis was hitting most of the economies in the OECD. And there was a perception and a realization that GDP that had been used, and GDP per capita that had been used as a standard metric to measure welfare, and including with the idea that if you achieved a certain level of GDP growth or of development, that would trickle down and everybody would benefit. Well, in the event, that was not the case, and there was a lot of suspicions that GDP growth and the GDP as a metric was really at variance with what people perceived as their own condition. There was unemployment, declining income, increasing inequality, low access to education in some countries, while at the same time GDP was growing. So clearly a problem with GDP as the right metric. So what happened is that then we tried to develop better metrics that would truly reflect people's living conditions, that would take into account, because we were interested in people's living condition, the distribution across groups, the young, the women, the disadvantaged, the handicapped, and so on. And most importantly, that the whole objective of all this was to change policies, to make sure that these new indicators would inform the policy debates so that the policies would actually be aimed at fostering for social justice. And there the role of official statistics is key, because you need reliable indicators which are sound conceptually, that you can collect on a regular basis, and that can address these issues which I just mentioned, and that government can trust to actually inform their decisions. So I'll take just, I know that the time is limited, so I just want to spend a bit of time to explain how we went about defining and measure, and then afterwards measuring what we call well-being, which is of course very much related to the notion of social justice. So we started by saying people are, if we want to represent the living conditions of people, of course material conditions are very important. So the income, their wealth, the jobs that they hold, the housing where they live, this all material sphere is essential. But look, this is not exactly as GDP, because this is taking the people's perspective, the household's perspective, not the economic system perspective. But beyond the material, there are a whole range of other dimensions, domains, that are very important for people's life. Of course, we discussed this morning a lot the environment and the environmental quality of life, the air you breathe, the water you drink, and so on, but also health, your health status, your work-life balance, whether you can reconcile work and leisure, the education education and skills of the people, the way that you connect with your community, with your family, the social connections, you can get a lot of support, and the way the family plays a big role, very important for people as well. Civic engagement, meaning people have a say, they want to be consulted, they have a say in the decisions that are being made. That was discussed extensively yesterday in the morning panel. So that's one of the domains we consider as important for the quality of life. Personal security, the fact that you can go out at night without being risk of being mobbed or anything like that. And another factor, another dimension, which is a bit of a, as Juraj mentioned, new, which is subjective well-being. Ask people what they think about the life they live. This is good for today's well-being, current well-being, how people living conditions are today. But what about tomorrow? And that relates very much to the discussion of the previous panel. Because you can have a lot of policies that will improve the well-being of citizens today, but if this is at the expense of future generation, is that good policy or is that bad policy? And so it's very important to also have policy that are cognizant of the issue of sustainability of well-being over time. And here the approach we followed is the capital approach, which is exactly what we discussed earlier, which is about ensuring that the future generation have the same amount of capital that will sustain their well-being, which will be current at that when they leave. But that goes beyond the natural capital, because we believe that it's also very important to maintain level of human capital, investing in education, health. It's also important to maintain a level of economic capital, not leaving public debt to the future generation, and also social capital. The way our societies are organized in different countries of the world will be different, but there are those very important values about societal and societies that is also important to maintain. So this is the approach we have followed. The characteristic of this is that it focuses on people, as I said, on households, and not just on the economic system. It allows to report through indicators not only on the average situation in the countries, but across population groups, and report on inequalities, capture both objective and subjective aspects of life, focuses on outcomes, performance, not just how much you spend on education, but is this good education? Is this well distributed? This is what we're interested in, and is concerned, as I said, about well-being today and tomorrow. For that, we have developed a number of indicators under each of those domains with the national statistical offices, and we regularly publish those indicators in a publication called How is Life in OECD countries, which I will be happy to share with you later. So here, and then I'm going to, because time is limited, I'm going to illustrate more than go deeply into the discussion on the sort of insights you can get for policies. So how is life on average in OECD countries? If you take all those domains, all the indicators that we have used to measure those domains, you can then group countries among good performers, middle performers, and low performers. And here that is used to benchmark. If you are at the top, such as Canada, the Nordic countries, in OECD countries, or if you are at the bottom, you want to understand why. What are the policies that have put you in such a situation? This is aggregate. You want to know, for instance, here is the UK, in all those dimensions, how do you perform compared to other countries? Here you can see that if you look at the UK, but of course you could do that for all other countries, the UK is doing rather well on environmental quality, social connection, personal security, but it's doing rather poorly in terms of education and skills. And this is on average. If you look at different groups, you can have much more detailed information as well. But what about social justice? This is what we were discussing, which is looking at the different disparities among groups. What has happened in OECD countries before the crisis, but even more after the crisis, is that income inequality has been rising in most countries, which is due to increasing income, especially at the top of the distribution, meaning that the richest have become even richer, which is creating a lot of frustration for the middle class. There is a middle class issue. And what we see is it's not just in the US, which we know is a quite unequal society, but in countries you would not have believed that income inequality has risen, such as Denmark, Sweden, for instance, which have becoming more unequal. And poverty now in OECD countries affects more than 12%, relative poverty, 12% of the population, reaching levels such as 20% or more in countries such as Chile, US, or Turkey, for instance. But what is important with this high income inequality and rising inequality is that it hinders social mobility, because we've run correlations between inequality, the level of inequality through the Gini coefficient, and the relations between the earnings of children compared to the earnings of sons compared to the earnings of their fathers. And you can see that the more unequal the society is, the more there is this sort of bias towards the importance of your economic background for your sons, which means that there is less social mobility in OECD countries. This is also true in terms of education. If you look at the performance of the children of well-educated families, then they perform better in school than the children of low-educated families. Again, creating unequal opportunities for the future. Very important to redress this, because you're creating this really problem of social justice for the future. If you're coming from a low-educated background, poor background, you don't give your children the same opportunities for the future. Same with health. If you look at, this is amazing, you would think that among OECD countries, the health status and the life expectancy of people is the same, no matter what. That's not true. Countries, you can have up to almost 20 years different in life expectancy at the age of 30, depending whether you are well educated, you are coming from a high income background or not. So very high unequal opportunities from good health as well. Again, an issue for social justice. But I would argue that gender inequalities, of course, matter a lot for social justice. We see in the OECD that countries that girls are not doing rather are better off in terms of health and in terms of education. But that doesn't translate into better jobs, better wages, better places in societies that are not as well represented in parliament, in big companies and so on. And they also indicate that they feel, for instance, very insecure at night, for instance, when they are in the streets and so on. So it's a lot of gender inequality that also is important in terms of remain in terms of gender gaps. And let me just, if I can, but it doesn't seem to work. Should I, can you push the button over there so that I can finish the presentation? Okay, no, it was another one. Just the one before? Okay, well, all right. But social justice, as I said, is also about asking people what they think. If you look at this chart, it's just an illustration to show that in two countries from this region, Egypt and Tunisia, where we are today, you can see that while GDP was growing quite fast, in fact, if you ask people about how they felt, their perception about their own life, you had a big discrepancy between, and some of this you can see can explain the social unrest that you've seen in those two countries. Now, let me finish by saying it's important to ask people, as I just said, and that's what we're doing at the OECD. We created an interactive tool called the OECD Better Life Index. I encourage you to go and do it, where we, as I said, we have these 11 domains that we have identified to define what is good living condition in the countries. We have now, we have not tried to aggregate, because it's not for us to say whether health is more important than education or security. But certainly you as an individual have a view on that. You feel that it's better to have a high income, perhaps a lower health or whatever. Those trade-offs is your choice, your preferences. You can express your preferences through this tool, which will then allow you to see which countries, according to your preference, is performing best. And this is the results. If you look at all the ways that have been recorded and collected by the OECD, you can see that what people want most is being in good health, have high education, the environment is important. Income interestingly, is not so important. So other dimensions are very key. And importantly, they want to be heard, because life satisfaction, what they have to say in subjective terms, perceptions, is also very high. So let me now conclude, if you can just pull out the last slide, to say that this is, can you move on, because I can't use this, okay, these new indicators do inform extensively the policy that is being, the debate in policy at the OECD through a number of processes. We conducted multidimensional country reviews. We've just done one for Myanmar. We're conducting economic surveys which expand beyond just the economy to look at those living conditions and make sure that the trade-offs between different policies, as we discussed this morning, do this cost-benefit analysis of economic policy in terms of education, in terms of the environment, and so on, are integrated in the policy recommendations. And this is based on all these indicators that we are producing. We're doing that also at the regional level for regional policy, something that has been extensively discussed today. And let me finish by saying that we nevertheless believe that there is still a lot of work to be done to get better indicators despite of this. And we are helping countries to build the capacity to develop those indicators that will promote, we hope, social justice through better information and influencing policies in a way that is really of quality data and through official data. So next, we're working on job quality and on trust, measuring the trust and the governance indicators, developing governance indicators for countries. Thank you very much for your attention.
Thank you, Martin, for your inspiring presentation. And from the conceptual framework, we will move now to challenges of producing and disseminating data related to social justice at the national level. So I would like to invite Mrs. Ola Awad, President of the Palestinian Central Bureau of Statistics. And Ola, you have the floor.
Thank you, Yurai. بداية أنا سعيدة جدا بالمشاركة في الدورة 28 للإسكوا، وسعيدة جدا بالتحدث عن العدالة الاجتماعية من منظور إحصائي فيما يتعلق بالمنطقة العربية. وأطلب العذر منكم أنه سأقوم بالتحدث باللغة الإنجليزية لسهولة التجانس مع المتحدثين، وأيضا لسهولة المصطلحات باللغة الإنجليزية من اللغة العربية. When we talk about social justice, many common vocabularies comes to our minds. But the problem is that most of these vocabularies are heavily used by politicians in elections campaigns. Some of these vocabularies come and stay, others are seasonal, and some others just come and disappear. But first, if I want to talk about what actually is social justice. So let's talk history thing. If I talk about the Aristotle definition, Aristotle defined it as individuals. This doesn't help actually. أشرف ممكن تروح تساعد لأن okay. So Aristotle defined it as individual both fulfilled their social roles and received what was due from society. If John Rawls in 1971 شو اللي بسوي أنا؟ هو خلاص انتو؟ Okay. So can we go to the next slide? So John Rawls in 1971 مش هيك بالله in 1971, who's actually the godfather of social justice, defined social justice as a balance between social equality and individual freedom. However, social equality and individual freedom are frequently seen as in tension, and debate continues as to how and to what extent they can be balanced. The United Nations in 2006 defined social justice that it may be broadly understood as the fair and compassionate distribution of the fruits of economic growth. But the likable definition for me is that it is a give and take relationship, but we have to make sure that giving and taking is not materialistic. So as Professor Koldak mentioned yesterday, that you can't actually do a balance of inequality balance, but at least we can, as policymakers, as decision makers, try and do our best not to have a high rate of inequality. So social justice is a system, requires both input, process, and outputs. ارجعي لورا, please. So, and what applies on economic justice? It applies on all of its elements. Next, please. Supporting social justice take different forms, not geographically bound. It is a two-way relationship. Some focus on healthcare as pivotal human well-being. Some focus on inequality. Some seek funding as priority. And some focus on peace-war dilemma. But social justice can be also moral support, skills, food, as well as money. Regardless of what form people or government seek, we need access to statistics that can be understood by all. So there should be an accessibility of statistics and understanding of statistics that is produced. The role of official statistics has evolved from being a mirror of society to a compass that guides you where to focus, to act as endoscope to diagnose the problems of society. This has eventually required the redefinition of what is official statistics and what is not. So we have different, by each country, official statistics plus. For us, for example, in Palestine, we need to provide statistics on detainees, on annexation wall, ارجعي لورا لو سمحتي, on annexation wall, and on settlements. And this actually doesn't apply except to Palestine. So when we want to identify, next please, when we want to identify the indicators of social justice, the most important thing that we have to have a participatory process to make it possible to generate public debate on core issues of priorities that meet needs of partners. So as we just discussed yesterday, we're not supposed to adopt the European social justice system or the Latin America's one. We have to have a participatory process that involves all partners in order to identify exactly what actually the needed indicators for the Arab region. Next, please. So let's take the Palestine case, which is for us considered in the Arab region is the most complicated case we have. And let's see. If I want to talk about, in addition of what we have about social justice, our case, in addition to the fully control of the Palestinian borders by Israel, the question is, please, قبل, خليك على السلايد القبل. No, أيوة هون. The question is, can we achieve such issue when we talk about social justice? Can we achieve it under the occupation? What is our national priorities? What people care about? Next, please. So the challenge we have is to maintain relevancy. To be relevant, you need to reflect the pulse of the streets. To be relevant, in addition to maintain the running of the routine programs, we initiated programs to suit emerging situations, talking about gender statistics, child statistics. We implement statistical activities to meet the context of Palestine, as, for example, the last war to conduct an impact of the Israeli war on Gaza, impact of the annexation wall on localities and households, and so forth. Next, please. To maintain also relevancy, we have to keep self-learning and self-assessing, and self-learning to conduct at least reviews on the work you do and the priorities that you have and you raise. And for example, what we have, we conducted the light peer review. It is the light version of the peer review of the European statistics. This is part of the self-assessing and also self-learning. Next, please. For users now, if we want to talk about users, for users, a toolbox is needed that provide relevant data on every single aspect of social justice that matters. How to provide users with tools to utilize statistics. Next, please. So let's see, for example, we have in Palestine, in our statistical office, what we established a statistical monitoring toolbox. This statistical monitoring toolbox has been actually prepared through a participatory process, and all our partners were involved, and they are the one who actually defined the required indicators of social justice. So this statistical monitoring system is not only accessible for policymakers and decision makers, it's also accessible for public too. And it is updated on a regular basis. And if you want, you can just go to our website and you can also have a look on it. We have another tool, next please, the Statistical Atlas Toolbox, which pinpoint the poverty pockets, which is really a good practice of partnership within the local and internationals. We have another good example, next please. Another good example of a partnership, command please, next. Another good example of partnership, the food security map, which is also part of social justice. And it was really a very good example of partnership, which has been actually worked with full partnership with the UN agencies. So what we provide, next please. We provide relevant indicators related to civil liberties, the perception surveys. Next please. We provide statistics on women's rights and working conditions. Next, please. We provide also data on inequality in labor access and access to information. Next. We provide indicators on what matters to people, the importance of the following for your life. So if you see this chart, you will see that the most important to the Palestinian life is the household, which is really very close to the World Values Survey. But when it comes to religion, it actually varies. We have 87% that religion is important to the Palestinian, compared to around 37% of the World Values Survey. If you talk about labor, it's much more important if you compare it with the World Values Survey. If you talk about welfare, which is important, but when you compare it, you will see that Palestinian, that actually for them welfare considered 32% in its importance compared to around 52% of the World Values Survey. So it does vary. Next, please. So we also provide indicators related to prosperity. Next. We actually also provide indicators on satisfaction on living conditions. We also, for us, it's really important on people's satisfaction about services, knowing the local context, what really matters to people. Next. لا نرجع please لورا. هون. Assessment also of essential services. Next. So we have also much commonalities exist among Arab countries, but the gap between users and producers of statistics vary from one country to another, and this actually, the practices reflects the reality. And we also have another challenge in the Arab region, which is the gap between policymakers, decision makers, and statistics. But if I want to just, next please. We all understand that numbers have power. But in the Arab region, it's still not part of our culture yet. And transparency challenge led to lack of trust and inadequate presentation. We know that statistics is in every aspect of our life. Next, please. But we have an issue of transparency and visibility. But نرجع لورا شوي. But actually, the problem can be solved by time. Next. So if I can give an example for you about statistics on public sector debt, and I'll raise a question to you to answer me. What is your preferable source? Is it the IMF? Is it the World Bank? Is it the United Nations Statistics Division? Or is it the national statistics? I'll leave the answer to you. But I'll tell you another example, next please, that the National Statistical Office can be the preferred source of information and can be visible and can be trusted. This is the user satisfaction survey results, which was conducted in 2013, and it was actually 71%. The National Statistical Office has the preferred source to other resources. So we know from accessibility and from transparency and from visibility, it is an issue, but at least it can be solved by time and needs a lot of efforts from us as statistical offices in presenting the data and being transparent and visible in our dissemination, and also from the other perspective of the users in giving the trust for the national, for the official statistics. My last slide is what actually the challenges ahead. Well, one of our main challenges is the international standards. This is our main challenge within the Arab region context. How can actually the international standards can also take into consideration the context that we face in the Arab region on one perspective, the legal coverage, providing statistics indicators on issues that government might not be of favor. And these issues are not yet part of traditional official statistics, such as corruption, rule of laws, etc. This is one of the challenges that Arab statistics has to deal with in the future. And the third one, it's, خلينا على challenges ahead. The third one, it's the national consensus. The fourth is about the technical cooperation and the harmonization in methods and in tools and practices. And the fourth one is securing the needed resources. And thank you very much.
Thank you very much, Ola. This was the view of national statistician and the view of statisticians in the Arab context. And now I would like to come to another aspect, and that is the view of development agency, the agency which helps countries in need to promote the progress, promote the development, including social justice. And Mr. Shantanayan Devarajan, chief economist of the World Bank's Africa region, will now let us to go through some examples how such data on social justice may be used and what are the needs. Shanta, you have the floor.
Well, thank you very much. Just one slight modification. I'm actually the chief economist of the Middle East and North Africa region. I used to be the chief economist of the Africa region. No, it's a pleasure to be here, and I really want to congratulate the organizers for this session, which I think is extraordinarily important. And what I want to try to convince you of this afternoon is that by measuring social justice, we actually can promote social justice. It's to echo some things that the previous panelists have said. Now, what do we mean? And I'm going to focus on some particular aspects of social justice. And let's just focus on education and health. There's a whole variety of dimensions, but hundreds of countries have signed universal declarations of human rights saying we will ensure that our entire population has access to quality education and quality health care. So governments have already committed to social justice in these two areas. Now let's look at what the results are. In this region, in the MENA region, the Middle East and North Africa region, we have.
I think it's easier for you to ask them.
No, that's okay. Somehow the graph didn't reproduce here. It must be a different version of PowerPoint. But I'll tell you, and I don't need to tell you, you already know, that in the MENA region, while we've managed to achieve basic education, the quality of education that the students get is extremely poor. One measure of that is how they perform on the PISA test, which is an internationally comparable test. And you find that for their incomes, the MENA region countries are systematically underperforming relative to other countries with similar incomes. And this is across the board, from Kuwait to Jordan to Lebanon. It's the same thing with health. And in health, it's particularly dangerous because it's poor people who are left out of the system. This is just an example of rural women who are unable to get antenatal care. It's at the order of 60–70% in our countries of the women who have never had antenatal care before they have their children. A serious failure in social justice despite the commitment. Now, what's going on here? I mean, what's happening? Because we know that enrollment rates are very high, but why is the education so poor? Well, one of the reasons is that the teachers are frequently absent. Across the region, we have teacher absentee rates that are of the order of 20 to 25%. They range within countries. Some countries, in Yemen, there are some districts where the absentee rate is 80%. So think about that. 4 out of the 5 days of the week, the teacher is not there. So it's not surprising that the children are not learning. And it's the absentee rate. If you thought the absentee rate for teachers was high, you should see the absentee rate for health workers. For doctors and nurses in healthcare facilities, it's of the order of 30 to 40%. Now, we all know what's going on there because many of these doctors are doing private practice. So they don't show up at their clinic, so the patients who are desperate, their kid is sick, they'll go and pay. Even though they're entitled to free care, they go and pay in the private clinic of the same doctor. As one woman in Egypt said to me once, you have a choice. You can go to the private doctor and lose your money, or go to the public doctor and lose your life. Wow. Right? This is the state we're in. Now, not only are these teachers absent, but when they do show up, what we have is a serious problem of their ability to teach. We're seriously underqualified teachers. In mathematics, there's a shortage of teachers, of qualified mathematics teachers of the order of 80% in some countries. So when they do show up, they're not equipped to teach. And we've done some of these vignette surveys for doctors as well, where we go in and test whether the doctors are following appropriate procedures for certain conditions. And there again, these public doctors, all of whom are trained, all of whom have medical degrees, about 50% of them don't follow the procedures for simple ailments, partly because they're trying to rush the patients through. So not only are the doctors not there, but when they are there, the quality of the service is very poor. And then just finally, what we're finding is that the equipment and the facilities in these clinics and schools is very poor. So you have stockages, you have clinics without medicines, without drugs, and teaching materials. There's a real shortage of teaching materials, including in some of the higher performing countries in the region. For some reason, the teaching materials don't get there. Well, it's not for some reason. We know what the reason is. This money is actually allocated to the clinics, and they send the drugs to the clinics. They get stolen on the way. The drugs that should be in the clinic, free drugs for the patients, get sold in the open market. And it's the same with textbooks for children. I've seen these textbooks that you're supposed to see in the schools. I see them being sold in the open market. So what is going on here? Well, this is what I would call a fundamental failure of accountability, right? The teacher or the health worker is not accountable to the student or the patient. Rather, they're held accountable by the government, who has very little ability, if the intent, to monitor whether the teacher is showing up. So the teacher can show up, can be absent, and the teacher continues to get paid. Or the doctor continues to get the salary of being a public doctor, and then gets paid extra in the private clinic and doesn't show up in the public clinic. And nobody, the patients and the students and the parents of the students have no ability to hold them to account. And they're the ones who know. This is where the statistics comes in. Because what we have found in other countries, in other regions, is that by disseminating this information, these statistics, such as the ones I just showed you, to the public, to the people who for whom it actually matters, you can actually create pressure. They create pressure on the system to actually deliver what they are due. Just to give you one example, in Uganda, we did a study where we asked the question, how much of the money that was meant for public primary schools actually arrived at the schools? And the answer was 13%, right? And this is a very poor country. But what the government of Uganda did was they published this figure in the newspapers. They put it on the radio, they put it on billboards. And that created a movement where parents, when they saw that number, they started demanding to know how much money was coming every month to their district. So they had to publish that in the newspaper every month. When they saw how much money was coming to their district, they went and asked the school principal, all right, now we see how much money you're getting. How come my kid says there's no chalk or textbooks in the classroom? So the schools now had to publish the budget on the schoolroom door. To this day, the budget is there. And that figure went from 13% to 90%. Just by the pressure of the public who were informed, better informed about the statistics of what is coming to their district. Now, my question is, can we do this in the MENA region? Now, this is a problem because this region, let me skip this. Oh, just to mention that what I mentioned about the private sector, we also have some evidence on that. In schools, the equivalent of the private sector is the private tutoring. And the expenditure on private tutoring is enormous. And again, it's the richer families that are able to afford that private tutoring. So once again, the poor are left out. And in health, you get it, it's reflected in the bribes that people have to pay in order to get health care. That is the private sector, if you like. These are public doctors who will not provide the services for free, even though that's what the law says, even though that's what they're paid to do, but they charge payments, and people are showing very large payments in order to get health care in the MENA region. So how can we use this information to actually promote social justice in the MENA region? And that's where I have some difficulties, and I need your help, because traditionally this is a region where the voice of the public has been rather muted, shall we say, right? That these international indicators show that the MENA region actually scores lower than other regions in terms of voice and accountability, just if you look through a whole range of indicators. Then if you ask the people themselves in the region, do you think that the elected representative represents your interests? The majority of them say no. They don't feel that even the elected representatives are ones who are responding to private demand. But I think there is a chance. There's a good chance that we can use this kind of information and get it out to the public so that they can raise their voice and demand what is their due. And that is very much the consequences of the Arab Spring. We find a greater openness, not just in the Arab Spring countries, but some of the other countries as well. Right to information laws being passed, representative democratic processes being introduced, and also decentralization, including in this country, in Tunisia, down to local levels where people have a closer link between policymakers. So I remain optimistic that if we can collect these data that I was just mentioning, we've been trying to collect, but more importantly, get it out to the public and get it out in a way that we can use modern technology. This is a very wired society as well, so we can use social media to get this information out. Something we couldn't do 20 years ago, and in such a way that people can bring pressure on the system to be able to get the government to deliver what it said it will deliver and promote social justice. Thanks very much.
Thank you, Shanta. This was interesting presentation about what we can do with data, because we as statisticians are usually focused on how to produce them, how to get them, how to define them, how to present them, but not what to do with them. So, may I now invite the audience to formulate questions, comments to our three panelists, if there are any. So we have spoken about the conceptual framework applicable in developed countries, but from which we would like to learn and develop our conceptual framework for the Arab countries. We have heard about challenges of national statistics, and we have heard about utilizing in data in making the political pressure for improvement and improving social justice. I think, Madam. Yes. Can you speak close to the microphone?
Comme ça, oui. هاجر شلواتي من تونس. دونك سؤالي موجه إلى مدام مارتين دوراند دو OECD. تحدثت الدكتورة على الكونكشن social connections أو الكونكشن سوسيال أو العلاقات الاجتماعية. كانت لي فرصة الاطلاع على مؤشرات المعدة من قبل OECD، وسؤالي هو كيفية قياس جودة هذه العلاقات. هل يتم ذلك من خلال الاطلاع على متابعة مستوى الجريمة في المجتمع، أو من خلال مدى احترام حقوق الإنسان في المجتمع؟ كيف يمكن قياس هذه العلاقات. أيضا خلال اطلاعي على مؤشرات المعدة من قبل OECD اتضح أن الOECD في قياسه للصحة يتجاوز قياس الصحة العضوية إلى قياس الصحة النفسية للأفراد. فكيف يمكن قياس هذه الصحة النفسية فعليا على المستوى الميداني؟ وهل ترى الدكتورة أنه ممكن قياس هذه الصحة النفسية في مجتمعنا العربي خاصة في ظل توفر إحصائيات محدودة في هذا المجال؟ ونشكرها.
Thank you. I suggest we collect more questions. Who is the next who would like to ask a question or make a comment? Or yes, madam.
Thank you very much, and I really have to thank the Secretariat of the ESCWA for giving us the chance to meet all of these distinguished panelists and experts, and that's a gathering that's really priceless, honestly. Of course, the presentations, all of them are very intriguing and very deep in the ideas that they offered. But I think for the last two presentations, I just have a question and a remark, and I would seek guidance on that. Sir, you mentioned, and I agree with you, that the bleak picture really of social justice in some of the Arab countries, at least during the period leading up to the Arab revolutions, and as Dr. Martin also noticed, especially in Egypt and Tunisia. Now you, and rightly so also, analyze that as a serious and complete failure of accountability, and that is also coupled with muted voices. Now, when we look on the other side of the world, and you look, for instance, to perhaps the most developed country, the United States, you see the same social injustices among, for instance, the African Americans. You see that the states where the majority of the population has African Americans, that the proportion of the budget, the actual appropriations are much, much less than what is for the white states. You see the lack of social mobility. You would see the degraded quality of education and almost lack of health services. And now coupled with some human rights abuses too, and we've all seen that on television, also abuses against the blacks and the African Americans. Now, would you say that this is also a clear picture of failure in accountability and muted voices? If you look into the European Union, for instance, and you go to some of the most developed countries in the European Union, aside from the newly acceded countries, in Germany, in France, in Belgium, again, the same injustices against the migrants from the Arab region. Very poor health services, very poor educational quality of education, lack of social mobility, high level of unemployment, abuses in their human rights and the practices of human rights. Again, this is the developed world, and we have the OECD having the proper indicators to measure all of that. So in a nutshell, can we speak about quote-unquote absolute specificity of the Arab region when it comes to social justice, or actually we haven't reached the actual reasons beyond social injustices, whether in the developing areas like the Arab region, and we prefer that to the MENA region, versus the developed countries. I mean, it's the same. Does it have, again, to do with races and religions and other factors, or it's just politicians, I don't know, losing the way? And it's just a question. Thank you, sir.
Thank you. I will ask Shanta to answer directly because he will have to go soon to the airport.
Thank you very much. I think it's an excellent question. And I fully agree with you. I mean, there are serious problems with social justice in the developed world. And I think Martine's presentation was alluding to that for the OECD countries and the United States in particular, is probably having a increasingly worsening social justice. But there are some differences. I mean, and I've tried to figure this out. Why is it that we don't see teacher absenteeism in developed countries, be it in Europe or in the United States? Now, what you do find in the United States is other forms of poor teaching that get reflected in very powerful public sector teachers' unions. Who then resist any kind of reform. I don't know whether, I live in Washington, D.C., so we live that day in and day out, but there has been quite a lot of controversy about trying to bring in competition into the public school system, and the teachers' unions have resisted it. But I think there is a difference, which is in the U.S. and for that matter in many European countries, traditionally, historically, education was private. It started out as a private function. Usually the clergy, the church was providing it, which I think created a certain ethic of performance, so that when it became a national function, you didn't have this problem of absenteeism. There was an ethic that was already created, so that teachers who were absent were considered misbehaving or by their peers. Now, what I don't find that in developing countries, and I think it might be that it was because these systems started out as public, so it was already one in which it was given for free, and there was very little accountability to the consumer, if you like, or the client. And so it's now become, in many countries that I work in, you know, the fact that a teacher is absent is considered almost a point of pride. I mean, it's not considered a failure to perform your public service. So I think there is that difference, and that's maybe the more distinctive one. But I fully agree with you that the levels of social injustice can be just as horrendous in some of our developed countries as they are in our developing countries.
Thank you, Shanta, and thank you for participation in our panel, and wish you a safe journey to Paris. I think, sir, you wanted to your intervention.
لدي استفسار في جانب القياس للعدالة الاجتماعية، وقد طرحت هذا السؤال يوم أمس، وعلى مدى اليومين ونحن نقلب موضوع العدالة من جوانبها المختلفة الاجتماعية في جانب العدالة بين الأجيال والسياسات يعني العادلة الاقتصادية وغيرها. هل ممكن نركب مؤشر أو مؤشر مركب لقياس العدالة الاجتماعية يأخذ في الاعتبار المتغيرات الاقتصادية والمتغيرات الاجتماعية والمتغيرات الأخرى السياسية، بحيث ننتج مؤشرا على غرار مؤشر تقرير التنمية البشرية أو التنمية الإنسانية اللي تصدره الأمم المتحدة؟ سيظل الحديث جميلا عن العدالة، لكن هل يمكن أن أنتج معيار أو مقياس أصنف الدول بحسب يعني تحقيقها لمفهوم العدالة الاجتماعية؟ أنا في اعتقادي سيظل الوقت فيه جدل كثير حول القضية، لأنه لم نحدد ابتداء أو لم يستقر مفهوم واضح لمفهوم العدالة الاجتماعية.
Okay, shall we ask anybody from our distinguished guests would like to ask? Yes, sir.
شكرا جزيلا. لعل القضية في محاور الثلاثة، تطبيق العدالة الاجتماعية من حيث الحظ في التعليم والصحة. أنا بفتكر أنه يعني الأخ المحاضر شتاين يعني كان متحاملا، ولم صحيح في يعني أشياء نقدر نقول عليها ممكن جدا تؤدي إلى انحطاط التعليم أو إلى انحطاط مستوى تقديم الخدمة الصحية، لكنها
أكثر تخصيصا يعني بنطرح حتى يعني عالميا من ايام ارسطوطل وبال71 اللي هو كان الاب الروحي جون رول للموضوع، هو لم يختلف على الإطلاق في تعريف مفهوم العدالة الاجتماعية، ولكن أنا باعتقادي إنه مفهوم العدالة الاجتماعية إلنا في المنطقة العربية هو جديد، وكمان صار له أهمية أكبر وأولوية أكبر خاصة في يعني خصوصية المنطقة العربية في آخر المستجدات. الموضوع اللي أنا بحب كمان أحكي فيه خاصة في قياس العدالة الاجتماعية، يعني إحنا بتجربتنا المتواضعة جدا في استخدام أكثر من أداة في هذا الجانب لقياس العدالة الاجتماعية. اتطرقت لكثير تجربة كانت ناجحة لنا بفلسطين، هو بناء ما يسمى بنظام المراقبة الإحصائي، واللي كان تم إعداده من قبل جميع الجهات ذات العلاقة، من جميع الشركاء، من حكومة وقطاع عام وقطاع خاص وجميع أطراف المجتمع المدني، في تحديد أهم المؤشرات اللي بتهمنا كفلسطين وبتهم كمان صانعي سياسات في بناء سياساتهم. وكان هذا النظام الإحصائي الوطني الفلسطيني هو عبارة عن 286 مؤشر، ولكن ويتم تحديثه بشكل دوري. في كمان كان تجربة ناجحة اللي هو الأطلس الإحصائي، واللي كان يحدد أكثر إشي جيوب الفقر عندنا بفلسطين بحسب التجمعات على أصغر تجمع، وكان هناك كمان ربط بين جيوب الفقر ومعدل البطالة، جيوب الفقر والمستوى التعليم للأفراد وما إلى ذلك. فهناك عدة أدوات لاستخدامها، ولكن في هناك أيضا جانب آخر، إنه إذا أنا قررت كمان كحكومة إنه بدي أعمل إلي إندكس زي ما تفضلت مارتن، أنا بالضبط هون بدي أجي أعمل حسب أولويتي كبلد، إنه أنا بهمني والله الفقر شو وزنه عندي، البطالة شو وزنها عندي، الصحة شو وزنها عندي، التعليم، اللي منه أعمل إندكس اللي أقرر إلي. ولكن هذا بيرجع بالآخر للدولة هي تقرر شو الأهمية المؤشرات بالنسبة إلها اللي بتعطي بالنسبة إلي شو العدالة الاجتماعية أنا بهاي الدولة. الموضوع الأخير ومش راح أطول فيه، هو دايما بنحكي عن الفجوة بين الإحصاءات وصناع القرار. أنا أتفق تماما إنه أنا صانع القرار ما في مجال يعمل ديجينج للبيانات ويجي يتطلع ويتفحص، بده يكون في إشي واضح قادر إنه يطلع عليه وعلى أساسه يبني سياساته. وبنفس الوقت في هناك أيضا دور آخر للأجهزة الإحصائية بكيف يتم نشر بياناتها بطريقة أسهل، مش إنه فقط هي بس يدوب الباحث المتخصص اللي قادر يطلع على البيانات. ففي كتير هناك كمان أدوات لنشر هاي البيانات بطريقة سهلة قابلة للفهم بشكل أوضح، في ما يسمى كمان بالداتا فيجواليزيشن، بالداتا أنيميشن، في اللي تفضل فيه دكتور حيدر الأوبن داتا اللي صرنا نحكي عنها البيج داتا. ففي هناك العديد من الأدوات اللي ممكن تسهل، ولكن أهم إشي بالنسبة لنا إنه لازم في النهاية إذا أنا بدي أبني سياسة كحكومة، في النهاية حكما بدها تعتمد على بيانات.
Thank you. So, thank you to our distinguished panelists. Thank you to you, Excellencies, distinguished delegates, ladies and gentlemen. We have accomplished the panel, but we did not accomplish the work. We will have, this is just the beginning of ESCWA's efforts to work on statistics, to work on indicators for measuring social justice and adapt them to the Arab region. Thank you very much for your active participation. I apologize for a little delay before the lunch caused by late beginning of the session. And if the Secretariat doesn't have any housekeeping issues, then thank you very much and bon appétit.